Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Dental cleanings, we know we're supposed to do them. They're important for your teeth, but also for your overall health. Some of those dental cleanings can give you clues to how you're doing overall. And we're talking with Dental Hygienist Jordan Cremeans about that today. Tell me, why is it so important that we don't skip those dental appointments?
Sure. So periodontal disease and systemic disorders have a number of common risk factors, including but not limited to poor diet, tobacco use, and stress. So all of these things can be associated with periodontal disease. So it makes sense that if you have one or more of these risk factors, you may have concerns with other health conditions.
So your dentist gets in your mouth and looks around. What kind of health, what can your teeth tell about your overall health?
Sure. So whenever the patient comes in, we are assessing them as soon as they come in, how they're walking, how they're talking. We check their lymph nodes to see if they are inflamed. So there's a lot of oral manifestations that systemic diseases can show. So we're checking around the tongue, we're checking the back of their throat. Cardiovascular disease can cause lesions to the back of the throat.
Okay.
We check for fungal infections. So we can check for with the dental x-rays, we can check to see if there's cysts, osteonecrosis, which is whenever your bone is basically diminishing. Of course, cancers, we can see that in the x-rays and in our oral examination. So we also check for sleep apnea, TMJ disorders. We can see if there is undiagnosed HIV or some STDs. We also can check to see if there's eating disorders like bulimia. We can see that if there's erosion in the teeth, or gastrointestinal disorders where they are vomiting and there may be some erosion of the teeth. So diabetes is a huge one. So we can check, especially in the x-rays, if there is bone loss that is associated with diabetes, and also smoking. But it is super important for patients with diabetes to come in to have their teeth cleaned, because if you have periodontal disease, if your gums are red and inflamed and bleeding, you have a wound the size of your fist in your mouth, and that is huge for diabetics because it's delayed healing and they may not even realize that they have that.
Yeah, I would say that's probably true about most of the things you just said. They may not even realize that you can catch sleep apnea at a dental appointment. Tell me a little bit about that.
Sure.
What kind of clues indicate that that could be a problem?
Yeah, so we check for the gums. A lot of times in the roof of the mouth, the gums are super red and inflamed. Their tonsils are a little bit bigger. And then we start diving in and asking questions. Are you snoring at night? Most of the time they'll say, yes, that we are, especially if we're noticing all these other things. And then we can refer them out to get a sleep study.
Yeah. Are people surprised sometimes when you kind of go in to just have a general cleaning and then all of a sudden you're asking them and they realize, I need to check that out?
Yes, they are. They like, how did you notice that? So they do have a lot of questions, and they are super surprised that we can see that.
Sometimes people are a little bit hesitant to go to the dentist, but this really speaks to why it's so important for your overall health.
Yes, it is, and we all understand that some people may have had trauma in the past, and it is a scary thing, but we try to make everything as comfortable as we can. If you are having some anxiety, we go through everything that we're going to do and explain that to you and be as gentle as possible. And while we're checking everything, we're explaining things to you and why it's important for us to do that.
A lot of people in this region have cardiovascular issues, and it's really important to keep up with those dental appointments. Are there things that people who have had cardiovascular procedures need to do before they go to the dentist?
Sure. So some people that have had heart surgeries or heart issues, they may need a antibiotic, a pre-med, before they come into the dental appointment, because we are stirring up a lot of bacteria. And again, that oral bacteria goes right to your bloodstream and can affect your heart and cardiovascular system. So it is important for them to talk to their cardiologist and ask them if they recommend pre-medicating before dental visits.
It's amazing how much of a big health picture just looking in your mouth can give you.
For sure.
Thank you so much, Jordan. We appreciate your time. Thanks for checking in on Monday Health Minutes.